Prostate cancer is a disease that some might be uncomfortable to talk about, but it's a very common cancer in Canada, and part of the screening process involves a blood test which the patient must pay for, but some believe it should be covered by OHIP. Daniel DeGraw has more.
That's why we are working so hard to pass my motion to have OHIP cover the cost of PSA testing when referred to by a healthcare provider.
Niagara NDP MPP Wayne Gates wants the prostate cancer blood test, known as the PSA test, to be free. And he's not the only one.
We need to push that message also with primary care physicians, which is really where the PSA as a screening test would begin.
Dr. Bobby Shagan from St. Joe's in Hamilton supports the test being covered by OHIP, but says wait times will stay the same, weeks to upwards of 6 months.
Our effort is really to leave gaps in our schedules for the urgent cases so that when you have somebody with a more dire cancer, that they're not just in the queue.
One physician says the discussion with your doctor should not be about whether you can afford the test, but whether you need it or not.
I asked him if he ever had a PSA test. He told me that 5 years ago his doctor had ordered one, but he couldn't afford to pay for the test, so he never got it done.
And now his patient faces a terminal diagnosis. Peter Ward, the husband of Burlington Mayor Marianne Mead Ward, had something similar happen, a conversation about cost.
There is a $39 fee. Do you still want it? I had a vague notion of what this test was for. That this test had a fee suggested to me that it wasn't that important. It was a nice to have.
He had the test, ended up being high risk, which plunged his family into what he called hell and uncertainty. The mayor says it's the what-ifs that keep her up at night.
What if he didn't have the money? He was asymptomatic, and we had no idea what was coming.
Prostate cancer is the third most diagnosed type of cancer in the province, according to Cancer Care Ontario. Danielle DeGraw, CHCH News, Hamilton.